Hi, this is Diane Carvo with caregiverrelief.com. Today's topic is what is ketamine and how it helps severe depression and treatment resistant depression. When I hear the word ketamine, the first time I thought, it's a psychedelic street drug known as Special K. Others think it's a horse tranquilizer, and they would be right. And others think of kids going to raves. And I believe the term they use when they use ketamine in these raves is K-holing. Many try it as a psychedelic to enhance their sensory perceptions. Yes, sadly, all of these things are true. There are many scenarios where ketamine has been abused or misused. The good news is ketamine has been used professionally in the medical world for decades. And it's a very highly respected medication because of the benefits it has. I thought I'd share a little history about how this drug went from being an anesthetic and horse tranquilizer to the biggest breakthrough treatment for severe depression or treatment resistant depression and other medical health conditions. It's the biggest breakthrough treatment in a century. Ketamine was created as a replacement for an anesthetic called PCP, also known as a dissociative anesthetic. PCP was causing long-lasting and severe hallucinogenic effects as a patient was waking up from surgery. Ketamine started as a veterinary anesthetic, and it was patented in Belgium in 1963. Testing on humans began in 1964. It was found that ketamine, as an anesthetic agent, produces minor hallucinogenic side effects, and it was found to have a shorter duration with less psychoactive effects than PCP. It was determined in 1965 that ketamine could be a safe anesthetic to administer to humans. Ketamine has been used as a club drug since the 1980s, and it was patented for humans and animal use in 1966, and it was produced by Parke-Davis Laboratories. It became available by prescription in 1969 under the name of Ketalar, or ketamine chloride. Because of the psychoactive properties, Argentinian psychiatrists and psychologists began using it to enhance regression therapy modules that they used. It was only a matter of time that people began using it illicitly for mind exploration and New Age spiritualism. There was a growing interest in the benefits of ketamine through the mid-1970s. Ketamine was used for both recreational and therapeutic purposes. Medical and non-medical uses of ketamine expanded through the 70s and 80s as an experimental uses became more common. I'm going to share a little tidbit here. Psychedelic psychiatry is a growing field, so the next piece of information to me is very interesting. In the 70s and 80s, ketamine actually became available via capsules, powder, tablets, crystals, liquids, and other injectable solutions in the illegal drug markets. The street forms of ketamine evolved over time, and other ingredients were added to alter the effects of ketamine. The result was a development of a new drug, MDMA, or ecstasy. There are many times ketamine has been sold on the street as ecstasy. MDMA is different from ketamine, as ketamine has anesthetic properties that can cause slurred speech or wobbly legs. And here's the tip that I want to make you all aware of. The FDA just approved MDA psychotherapy to start in 2023. We are seeing a new way to treat mental health issues. It's exciting news, and this is the announcement that started it all. In March 2019, the Food and Drug Administration approved a form of ketamine for the treatment of depression. Esketamine is a nasal spray developed by Johnson & Johnson. This breakthrough medication, esketamine, was the first new drug treatment approved for depression in decades, and it is a cousin to ketamine. The FDA-approved J&J's drug is called Spravato. The study results on Spravato showed patients taking the drug experienced a bigger improvement in their depression versus patients taking traditional antidepressant treatments. This was measured with the use of a psychiatric questionnaire. Okay, I've shared a little bit about the history. I want you to know that ketamine is safe when provided under a doctor's watchful eye. Ketamine has been used around the world to provide safe sedation for medical and surgical procedures. It is what they call a dissociative anesthetic. Simply put, it makes you feel detached from your surroundings. It is a hallucinogenic like magic mushrooms or nitrous oxide, which we know is laughing gas. It creates feelings of detachment or disassociation from a person's environment and even their self. This is why it was the perfect medication to be used on the battlefield, and it has been used for decades to save the lives of thousands of soldiers. Ketamine is thought to work on the brain by blocking the communication chemical in the brain known as a neurotransmitter or glutamate, as well as disrupting the receptor sites in the brain, altering your perception of pain, responses to environmental stimuli, and memory. Ketamine has been studied for years in the field of psychology because of its ability to rewire the brain. When neuroimaging has been reviewed on a brain before and after the treatment, the findings are remarkable. Imagine the brain of a severely depressed person. The before pictures of the brain look like a tree in winter. They are naked branches. The branches are spread out over the brain. After ketamine treatments, the neuroimaging pictures are vastly different. Now imagine a tree in the spring or growing into summer. Leaves are coming out. The tree is back to life. The tree branches are the connections or the neural pathways. The neurotransmitters in the depressed brain are no longer communicating. There is poor communications between the cells. After ketamine treatments, the leaves are the synapses or communication system of the brain. There is increased communications. New neural pathways are being developed. It is awakening and rewiring the brain. Ketamine has become a revolutionary medical approach to depression, PTSD, anxiety, bipolar, obsessive compulsive disorders, and other mental health challenges. And ketamine is also a very strong painkiller and anti-inflammatory. It has been successful in treating those with the severe pain condition RSD or reflex sympathetic dystrophy, also known as chronic regional pain syndrome, CRPS. It is changing the lives of many that have suffered from severe depression, treatment-resistant depression, and even those with active suicide ideation. The good news is individuals suffering with major depression and diagnosed with treatment-resistant depression are making amazing progress with ketamine therapy. I'm going to jump in here and to give you a little bit more on the history. So how did the doctors determine that ketamine helped depression? Ketamine was often used by first responders. It has been given to agitated patients and some that were rescued from suicide attempts. Doctors began to realize that the drug had powerful effects against depression and suicidal thoughts. Patients that were admitted to a mental health facility after a suicide attempt were expressing they no longer were having suicidal thoughts. As early as in the ambulance on the way to the hospital, many reported that they didn't have those feelings for months afterwards. This led to research studies that have discovered this medication not only treats those that have tried many traditional antidepressants and never felt any improvement, Or over time, the medication stopped working and there was always an increase in the dosage or another medication was added. Ketamine has been proven to provide immediate relief from suicidal thoughts. Just a note here, traditional antidepressants take months to relieve a therapeutic level that makes a difference in your depression. Ketamine therapy is truly changing the lives who have tried everything to feel better, but without success. So we've discussed the history of ketamine, how it works and its therapeutic benefits. Now let's discuss what is the most effective form of administration. Not all routes of administration create the same response. Let me explain. Ketamine is a very versatile drug because it is both water and fat soluble. So the route of administration or the form you take it can vary. Ketamine can be taken by mouth, intravenous, epidural, and transnasal, as I mentioned with the J&G esketamine nasal spray. Let's start with the most common form of administration for antidepressant effects, and that's intravenous. This is injected into a vein. When ketamine reaches the bloodstream, it circulates through the body and binds to NMDA receptors. The main benefit of an IV ketamine treatment is that it bypasses the digestive system. The digestive system slows down drug's onset. This delay may due partially to the liver metabolizing the drug or that the drug is poorly absorbed by the intestinal wall. Of course, this will differ from person to person. Oral ketamine can take up to 30 minutes before effects are experienced. In comparison, IV ketamine can be felt within a few minutes. That's why it's so useful as an emergency sedative for first responders. Ketamine can also be administered by intramuscular injection, or called IM. Studies suggest that IM is effective as IV in the treatment of depression. There is a difference that should you seek this more cost-effective treatment of IM ketamine. IV infusion requires one needle stick to start at the IV, usually if you have good veins and you have a good healthcare provider that knows what they're doing on starting IVs. An intramuscular injection, IM, may require multiple injections per treatment. That will depend on your response to the initial dose. The benefits of IV ketamine is that the dose can be increased, decreased, or stopped depending on your response during the treatment. An intramuscular injection cannot be adjusted. Many patients have found that IV infusions seem to maintain symptom relief for longer periods between treatments. Patients having intramuscular injections may require more frequent treatments. Now, let's address esketamine nasal spray. This nasal spray does not produce immediate effects. While you may not feel the effects as quickly as IV ketamine, some believe it has longer duration between treatments. This is an important thing to note. Researchers are also currently exploring ketamine spray as a potential treatment for chronic cluster headaches. Ketamine also comes in an oral lozenge form. Oral ketamine is not absorbed as well as other administration methods. They are used between IV treatments for some chronic pain patients at times. I hope this information helps you make decisions on exploring ketamine as a treatment if you suffer from treatment-resistant depression or suicide ideation. I put a booklet together on everything you want to know about ketamine, and you can find it on caregiverrelief.com. I'm Diane Carbo, RN. If you're a family caregiver, remember, you're the most important part of the caregiving equation. Without you, it all falls apart. So please, practice self-care every day. Be gentle with yourself because you are worth it.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.